Hi, I'm Neely Scott, the Recruitment Director at Bell Family Company. Today I'll be walking you through some helpful tips on caring for newborns and infants. Caring for newborns and infants is one of the most rewarding and delicate roles in childcare. Your presence, attention, and responsiveness will make a lasting impact on both baby and family. Today, we will be focusing on tasks pertinent for children ages 0 to 12 months. Let's get started.
The infant stage is a delicate time for both parent and baby, so it is especially important for the childcare provider to be patient and understanding. Some ways to remain present and extend patience are to learn baby's cues. Crying, brooding, eye rubbing, and arching back are some of the many ways a baby communicates what they need. Use BFC and online resources to learn cues to be a more responsive infant caretaker. Use a calm voice and slow, gentle movements when engaging with baby. Expect fussy periods during cluster feeding, teething, or growth spurts. Stay calm to lower stress for both baby and parent. When caring for a newborn or infant, a lot of your time will be spent feeding and burping. Always follow the family's feeding plan exactly as they lay it out for you, and heat up milk as directed by the parent because everyone does this differently. Always hold baby semi-upright for feedings, never flat, and burp every 2 to 3 ounces. Ask the parent how they've been burping the child to keep it consistent. Watch the baby's hunger cues. Rooting, sucking hands, smacking lips are all examples of the baby telling you they're hungry. Watch for fullness cues. Turning away or slowing down on drinking the bottle can tell you that the baby is getting full. Always wash and sanitize bottles thoroughly and track times and amounts that the baby ate if requested by the parent. Never prop a bottle up with a baby or put a baby to sleep with one. Now enjoy this instructional video on how to burp a baby.
Hi, we're gonna go over burping a baby. So for babies that are up to like 3 or 4 months, you're gonna make sure you have a good balance, hold the baby's jaw, and pat the baby so. If the baby's still not releasing the gas, you can try different methods. Put the baby up on your shoulder, make sure you have their head secure, and pat the baby's back. If the baby is a bit bigger, like 6 months and up, you can put the baby back on your leg, and you can hold the baby by the body and pat the baby that way. And that's how you burp a baby.
Safe sleep practices, according to the American Academy of Pediatrics, is to always place the baby on their back when putting a baby down for a nap. The saying that you can remember is back to sleep. The parent will be using a firm mattress with a fitted sheet only in the crib. You should not add blankets, pillows, bumpers, or toys into the crib when putting the baby down to sleep. Supervise naps frequently. Check breathing, baby's skin color, and if the position that they're sleeping in looks comfortable. Always dress a baby in one light layer more than you would wear when putting them down for a nap. Most of the times, this is footy pajamas and a sleep sack, or their day clothes, socks, and a sleep sack. As we all know, caring for newborns and infants is a lot of diapering and keeping the baby clean and hygienic. Check diapers every 2 to 3 hours and after feedings. Always wipe a baby from front to back for girls and clean under folds for all babies. Apply diaper cream only as directed by parents and track wet or dirty diapers for health monitoring. You can type this into your phone and send it to the parent or add it to a notebook if the parent has that at home. Wash hands before and after every diaper change. Please enjoy this video of how to diaper change a baby.
We're gonna go over diapering a baby. First, make sure that the baby is securely fastened in. You're gonna make sure that the baby is clean and wiped down from front to back. Take the diaper, lift the baby's bottom, and securely fasten the snaps from back to front. And you're gonna make sure that there's 2 fingers width between the baby's body and the diaper. And that's how you diaper a baby.
There are many ways to soothe and bond with a newborn or infant, one of which is to swaddle for security. Please watch this video on how to swaddle a baby, and do note that we do want to stop swaddling a baby once they show signs of rolling over, which is around 2 months old. You should consult the parent before they leave on if their child is still being swaddled and how their child prefers to be swaddled.
Hi there, we're gonna go over swaddling a baby. You're gonna place the blanket like this. Many of the swaddle blankets have instructions, just in case you need a refresher. Make sure the baby's neckline is aligned with the blanket. You're gonna wrap the swaddle blanket down, up, and around. Make sure that the blanket is secure around the baby's body, and then you can tuck this part into the blanket. Lift up behind their head, and that's how you swaddle a baby.
Other ways you can soothe and bond with a newborn or infant is to rock them, gently bounce them, or baby wear. Now, every family does baby wear differently, so have the parent show you their baby wearing carrier or wrap ahead of time and how to use it safely. You can use a white noise machine, hum to the baby, or use shushing sounds to calm the baby. If the parent has approved it, you can offer a pacifier for effective soothing. Every baby does respond differently to soothing and bonding techniques, so have the parent explain to you ways they have found that are most effective for their baby and mirror those soothing and bonding techniques during your appointment.
Hi, I'm going to go over soothing an infant and a toddler. First, a couple of techniques that work are walking with the baby, shushing the baby, getting on his level, and rubbing the baby's back. Singing to the baby works too, and also sitting down with the baby and finding a quiet space to read with the baby.
Use your time with the baby during their wake windows to support their development with age-appropriate activities. Some of these can be talking, singing, and reading to the baby in a calm yet expressive voice. You can provide supervised tummy time, usually 2 to 3 minutes several times a day. Offer safe visual and tactile experiences with the baby. You can use soft toys, black and white books, and gentle music. Engage with the baby and encourage eye contact and respond to their coos and babbles. It's important to be able to recognize red flags when caring for newborns and infants. Call parents if a fever ever gets above 100.4 degrees Fahrenheit. Watch for difficulty breathing, wheezing, or grunting. Notice unusual lethargy or extreme irritability from the baby. Report refusal to feed for multiple feedings. Track wet diapers. A good rule of thumb is fewer than 4 in 24 hours is concerning. And watch for blue, pale, or blotchy skin. Maintaining communication with parents is important when caring for newborns and infants. Some ways to do this are to record and share feeding, nap, and diaper logs. Provide short updates with the parent on the child's mood, any milestones or sweet moments you notice. Always stay calm and reassuring when interacting with new or nervous parents. As we mentioned in the beginning of this video, it's a delicate time for all. Send photos, but only if pre-approved by the parent. Many new parents like to see what their little one is up to throughout the day. Always listen very carefully and respectfully when parents are giving you requests. Feel free to also take notes, as this eases the mind for the parent that you're paying attention and going to retain the information. When caring for children of any age, safety is of the utmost importance. Safety tips specifically for newborns and infants to be aware of are to never leave a baby unattended on a couch, bed, or changing table, even if the child has not begun rolling over yet. Always use a rear-facing, properly installed car seat when traveling in a car. Keep small objects, cords, and hot liquids out of reach. No infant CPR and choking procedures. Email info@bellfamilycompany.com to get the link to our free CPR training, and take this training before you ever take a BFC job with an infant. And finally, keep the family's emergency contacts and pediatrician information readily accessible.
Thank you for joining me today as you either learned or brushed up on these key tasks and skills related to caring for infants and newborns. Happy sitting!